Well, I'm happy today to welcome William Teague. William is a 2010 finance and economics graduate from University of Tennessee, and currently William is a director in the Valuation and Transaction Advisory Services Group at VMG Health in Nashville, and that's kind of a mouthful. So we'll get to that in a minute. But first of all, thanks for joining us, William. Appreciate talking to you today. Appreciate getting to know you recently. So welcome.
Yeah, thank you for having me. Excited to talk to you. Always love reconnecting with folks at UT. Missed my college days, so it's a great opportunity to get back connected with the community. So.
Yeah, well, and we want to connect with you as well. So I read off your title, Director of in the Valuation Transaction Advisory Group, VMG Healthcare. What? Let's just start with that. What is that?
VMG is a healthcare consulting firm, and most of the consulting services we provide are surrounding some sort of transaction. Company A buying company B. So me personally, in the Valuation and Transaction Advisory Group, I'm advising my clients what they should pay for company B. Company B is worth $10 million, right? So you should pay $10 million. We're doing financial analysis, discounted cash flow analyses, due diligence as a big part of our group. So going in and making sure that the financial statements are accurate and that there's no risks involved in the transaction.
Okay, so when you say that, I immediately kind of think about investment banking. A lot of what you said sounds familiar to me as someone who's talked to a lot of investment bankers, or at least that sounds like a part of what investment bankers do.
On a seller, an investment banker acts as a broker, right? They are trying to make a pretty prospectus, if you will, and go out to potential buyers and say, you should buy this company. And they run this auction process, and the buyers come in and make bids for the company, and they pick the highest bid, right? So at least on the sell side. And, they're not necessarily doing valuation work. They probably do some preliminary valuation work so they think they know what the company's worth when they hit the market and solicit buyers. But I think about investment banking as less around hardcore valuation theory and methodologies and analysis, and more almost like a broker, right? You're an advocate for your client. You're trying to get them the highest price and come up with a sales pitch on why these folks should invest in this company.
Yeah, so there's very much a selling / matchmaking role.
Correct.
That they play.
And then once
so all the matchmaking's already happened before you're even in the game.
Correct. So, a lot of our clients are buyers, right? So we'll get calls from folks like a big health system. Hey, there's a big physician practice in town or surgery center in town, and they called us and want us to buy them, right? So the buyers will hire us and be like, well, what should we pay for this business? Some of it's regulatory driven. Some of it is our clients don't have that capability internally, right? So they need to outsource that. They don't do transactions every day, right? Like a hospital, they might buy a couple businesses a year. So they don't necessarily have dedicated teams that know about home health and what the valuations in the sector look like, right? And maybe they don't have the expertise to go in and do really detailed financial analysis or due diligence or, cash flow projections. So they'll bring us in to kind of consult on what they should pay for it. But I think a big distinction too is that we act as an independent third party. So we're not an advocate, right? We're not trying to get the best price for the seller or the lowest price for the buyer. We come in and just consult on what we think the business is worth. What's fair market value, right? So think about it in simple terms. When you're buying or selling a house, the buyer and sellers can come to an agreement, but they go get an appraisal to make sure that, hey, that what they've agreed to is fair market value, right? So that's a lot of our work. And then, due diligence too. Like we get hired by investment bankers all the time who are selling a company, and they want us to come in and kick the tires and make sure everything looks good from a financial perspective, that we can identify, risk areas or, deal breakers, if you will, that might come up in the negotiation process. And then we have a lot of private equity clients that, are, hey, we're looking to invest in healthcare. Healthcare is a very unique industry, and we don't know much about it. We've historically invested in factories or in, technology companies. We don't know anything about healthcare. So we come in as healthcare experts to help them understand the risks and the valuation side of the transaction.
So I want to play on that just a little bit, the healthcare part. So and I think we oftentimes think about the idea of generalists out there. And so when I say generalist, what I mean is someone on the valuation side who is just sort of thinking about, hey, I understand financial statements, I understand pro formas, I understand conceptually how to do discounted cash flow. And so, I can kind of put together a spreadsheet and figure out a value. And I can do that for, I can do that for a car manufacturer. I can do that for a software company. Discounted cash flows is discounted cash flow. So that's sort of the generalist view. You all, VMG Health, you have health in your name. And so you all only do healthcare. And so you are everything but a generalist, right? You are absolutely a specialist in healthcare. What's sort of the value of specializing, and is there something unique about healthcare that sort of warrants more specialists that might be warranted in some other industry?
Healthcare is about 20% of the economy, right? And it is unlike the rest of the economy where a company creates a product and decides they want to sell it for this price. Healthcare is very regulated. The consumer, i.e. the patient, isn't necessarily paying for the service that they're buying, right? Your insurance company is, or Medicare is, or Medicaid. There's all these very regulated structures in the industry that require a lot of knowledge and experience on how it works, right? And we always tell our analysts that come in, that's probably the hardest thing to do. It's not the valuation or modeling or, Excel or pro forma work or discounted cash flow or any of that stuff. It's learning healthcare. So when you look at professional services in general, investment bankers, lawyers, accountants, consultants like us, generally speaking, in healthcare, they're all very specialized, because if you are dealing with car manufacturers, you're going to have no idea how the payment dynamics worked in healthcare, or the different laws and regulations like the Stark Law or the anti-kickback statute or fraud and abuse regulation. So it's just such a opaque industry in terms of, it's not, hey, I'm making a widget and I'm selling it for X price. It's, you're providing a service. And, a lot of times when someone goes into a hospital, there's 15 different companies that are providing their care. It's not just the hospital, right? There's the anesthesiologists that come in and maybe they have their own company and then there's the surgeons, and then there's the hospital itself. And then there's the, medical device manufacturer. So it's just so complicated, and it's so unlike other industries. It's really hard to be a generalist and play in the space. You got to be an expert to know what you're doing. And as a consultant, right, what are you selling? You're selling your expertise. People hire you because they think you're smart and they think you know something that they don't. So, but I also think it's great to be a specialist, specifically in healthcare, right? Because once again, it's 20% of the economy, and people don't realize that it's more than just your local hospital. There's, 20 different sub industries, if not more, in healthcare, right? You've got ambulatory surgery, diagnostic imaging, home health, physical therapy. There's all different kinds of healthcare that fall under the healthcare bucket. So,
Right.
As a person with healthcare skills, it makes you very marketable and very mobile geographically, because every town's got a hospital, right? There's healthcare companies throughout the country. So pretty much anywhere you move to, there might be opportunities for employment, and your skills are scarce, right? So it makes you very marketable. and especially here in Tennessee, Nashville is the healthcare capital of the country. There's a lot of opportunity there. But then it also makes you really mobile in the sense that, every town has some sort of healthcare business that if you know the industry, which not many people do, it's actually a pretty small community of professionals that are kind of healthcare specialists.
On the specialization, so I do want to dig into this a little bit more so maybe I can appreciate this a little bit better. So contrasting healthcare with this widget manufacturer, whatever it may be. So the widget manufacturer sells widgets, and you've got customers out there and people are buying your stuff, and you don't have a whole lot of differential pricing. You don't have a whole lot of differential delivery models, but I think I would naively come into this thinking that the customer in healthcare is just the individual patient. But and in some sense, from a patient care perspective, yes, that's true. But as far as the paying customer, it's not. It's typically what you've got. You mentioned them earlier. You've got Medicaid, so the government, and then insurance. And insurance, you can narrow that down to maybe two or three big companies. So really, you've got. We'll just round this off. You've really got four big customers.
Yeah, I mean, so the biggest customer in healthcare by far is the government, right? Medicare and Medicaid. Medicare covers anyone over the age of 65, those are the people that utilize the most healthcare, right? And the government every year decides, they publish a list of all the different kind of healthcare services out there, which there's thousands, right? Everything from I had an ear infection to, I was shot and I need surgery to remove the bullet, right? So the government every year just decides what they're going to pay for those services based on these formulas that they come up with. And then the big commercial insurers, which, hey, you come work at VMG, you get Blue Cross Blue Shield, right? Well, they pay what they've negotiated with each individual hospital. So Blue Cross will go to Vanderbilt, or it'll go to HCA here in town, or St. Thomas. And hey, I have an ear infection. Well, Blue Cross might pay HCA $100 and pay Vanderbilt $110 because that's just what they negotiated. So, and the other thing, the government is the biggest customer, and so the government really wants to protect the taxpayer, right? So that comes with a whole long list of regulations and hoops you've got to jump through to get paid and all of that sort of thing. So that kind of is what is so complicated about healthcare is, which blows people's mind. You go to the grocery store, you pay $10 for a gallon of milk, or that's probably not right. That's pretty expensive, but you pay.
You haven't been in the grocery store in a while, have you?
My wife goes to the grocery store. So, pays whatever for a gallon of milk here. Well, across the street, that gallon of milk is probably going to be the same price. Well, in healthcare, that's not necessarily the case, right? And it can be very different. And Wall Street Journal's put out some great studies that, getting your knee replaced at one hospital was triple the price at another out in California. So it's super complicated and complex, and it's not a consumer driven industry, right?
Yeah. So the consumer's not going to be responsive to those prices, right? The consumer doesn't say, I'm going to buy your $2 milk and not your $10 milk. The consumer's going to go wherever they go based on sort of the history of their.
Yeah. My brother went to this. My brother went there and had a great experience. So I'm going to go there. But, it's changing a little bit now that consumers have high deductible health plans, right? So they are on the hook financially for the first, $5,000 or whatever your deductible is. But, a lot, if I am getting a knee replacement and it's going to more than go over my deductible, I don't really care who the cheapest is because I'm not paying for it. The insurance company is, right? Or Medicare is, or what have you. So the competition in healthcare is really not necessarily who's got the lowest price, but who's got the best doctors, the best reputation, the best capabilities to attract the patients to then utilize their services. So it's not necessarily all based on price. I mean, that's more and more of a factor these days. There's all these new payment models that they're coming out with, they call value-based care. But it's an industry changing, right? It's transforming from this, X dollars for this procedure to more of, population health, quality outcomes based rather than based on volume. So I think it's a really it's a huge industry, and it's undergoing revolutionary change as we speak. It kind of did it back in when Obama was president and passed the Affordable Care Act, but with the high levels of inflation and huge budget deficits, I think everybody realizes they've got to get healthcare costs down. So there's really a lot of change in the industry, which is good for consultants
Yep.
like me, right?
Yep.
Because
Yep.
people are doing transactions to cope with that change. So
Yeah, and then ultimately this affects the value of those transactions, right?